We go to the latest aspects in training that organizing such programs, that is a future trend in artificial intelligence in wet lab practice. It is been by Dr. Nikitha Ahmed, and she also is a staff working in the Department of Ophthalmology of Malabar Medical College, Calicut. Over to Dr. Nikitha.
Thank you, sir. Good afternoon, everybody. So till now, we were hearing about how to set up a cost-effective wet lab and how to train the residents. Now we'll move on to future trends and artificial intelligence in wet lab practices. So surgical experts are made and not born, and surgical expertise is acquired through deliberate practice, and improvement in surgical skill lead to better outcome as well as fewer surgical complication. In traditional training in ophthalmology, a trainee is considered to be competent upon completing a certain number of surgical procedures under supervision, which is heavily dependent upon the trainers. But the problem with traditional training is there will be insufficient surgical training due to few patients for hands-on experience, randomized teaching by different trainers. There will be a long learning curve, as well as since we are doing it on a live patient, there will be performance pressure as well as risk of permanent visual loss. And if we are training it on a goat side, there is issue of tissue availability as well as different tissue field. So coming on to virtual reality surgical simulator, when we talk about simulation training, aviation stands out as a profession where simulatory training has been carried out with immense success. With the help of simulation training, the pilots were trained. They were trained in rare accidents or rare situations on a day-to-day basis in a low-risk environment, and thus reducing the accidents in a significant manner. So similarly, in a surgical simulator, we can impart both basic as well as complex procedure without endangering patient and thus improving the surgical skill. Ophthalmic practice witnessed the dawn of virtual reality simulation in the year 1992 with the invent of retrobulbar alcohol simulatory injector, and later on they developed cataract surgery simulator as well as vitreoretinal surgery simulator. So these are some of the common surgical simulators used, out of which IC and MicroVisTech has all the modules for phacoemulsification, small incision cataract surgery as well as vitreoretinal surgery, and PhacoVision and Help Me See Eye simulator is basically for cataract surgeries. So this is a Help Me See Eye simulator where you can see an operating microscope, section to hold the eye, 2 ports to introduce the instruments as well as a computer. So coming on to cataract surgery training, in simulator we have both small incision cataract surgery as well as phacoemulsification module, and in small incision cataract surgery you will be able to do all the steps including tunnel construction, rhexis, side port, hydrodissection, nucleus delivery, IOL insertion, even suturing. So this is a small video in which they are showing how the simulator works. In the tunnel construction, you get the exact same feel as that of the human eye, and the simulator will guide you in depth. If it's going deep, the simulator will turn red. If the rhexis is going into the periphery, the instrument will turn red, and thus you can master the technique as well as you can practice IOL insertion, CTR insertion, suturing, etc. And in phacoemulsification also, you will be able to do all the steps including rhexis with a micro-rhexis forceps, hydrodissection, trenching, aspiration, IOL insertion, using a proper foot pedal, and you can change all the parameters according to the grade of the cataract we are practicing. So this is a simulated training of phacoemulsification where you can do rhexis, trenching, etc. So this is a rhexis being done, and after changing the modules, you can do both trenching as well as aspiration. This is the trenching being done, aspiration, and after injecting the visco, you can introduce the IOL also. So, cataract surgery training in a simulator comes with definite modules, which is structured with the tier A using introductory module, tier B for beginners, tier C for intermediate, and tier D for advanced. And after each surgery, score will be given to each steps, and a final score will be given to the trainee, and the trainer can video review each surgery and can give necessary correction then and there itself. Coming on to vitreoretinal surgery training, after using the biome, you can practice several steps in vitreoretinal surgery, including membrane peeling, and after correcting the vitrectomy rate, you can do both core excision and base excision, and you can practice other techniques like endo laser also. So this is where endo laser is being done, and you can also do the vitrectomies. And the vitreoretinal surgery also comes with definite modules, tier A, which is introductory, tier B for beginners, and tier C for intermediate. The advantages of virtual reality simulators are, it is a standard teaching procedure with improved technical skill acquisition, since each step can be repeated by the trainees in a low risk environment, and it will be more structured method of evaluation, and video review can be done. There are no ethical issues, but the limitations are heavy cost of bearing of equipment and maintenance. Technical glitches can be a challenge with VR. VR reactiveness and human eye sensitivity might be slightly different, and after all, VR is a simulation. Human eye can create much more complex scenarios. And other applications for virtual reality simulators are direct ophthalmoscopy simulator, indirect ophthalmoscopy simulator, and slit lamp simulator, which can be used by residents to know how to use each of these instruments, where to look, and how each pathology will look like before they start looking in the real patients. This is direct ophthalmoscopy simulator, this is indirect ophthalmoscopy simulator, and this is a slit lamp simulator. So, structured and supervised simulation training can impart a significant level of skill to the novice surgeons as well as trainees. This is happening all over the world, but in India, due to cost constraints as well as practical feasibility, it is available only in few centers, but hopefully in near future, we can expect it reaches all the teaching institutes. Thank you.
Thank you, Dr. Nikitha, for that a very good presentation of what next in a teaching methodology of to